everyone, and let's talk today about Sepsis Advisor and the identification and treatment of sepsis in the new HIS. So what is Sepsis Advisor? It's really a one-stop, adult-only sepsis management module within Oracle Health or Millennium. It applies all across the hospital, not just the emergency department. It includes constant sepsis and septic shock surveillance using SIRS criteria in the emergency department and Muse scores everywhere else. It is not active for ICU patients. It includes notification or alerts to both staff and physicians, and it has built-in suppressions so that you can suppress the alerts once you've taken action. Within the Sepsis Advisor, there is a built-in management algorithm that makes treatments and management suggestions to make management of sepsis much easier. So how do you find it? Sepsis Advisor is an order. You can find it in any way you'll find an order. In the tracker in the emergency department, patients who have a sepsis alert will have a red flag in the first column next to their names, and once you try to open the patient's chart, you'll get a sepsis alert that tells you why you're being alerted and gives you options to do things. However, you can launch Sepsis Advisor from anywhere else. Here, I'm launching it from ED Quick Orders by typing in sepsis in the search. And you can see all the sepsis options we have. Sepsis Advisor being the top. If you write Sepsis Advisor, you can just select it. Sepsis alerts and their suppression. This is a typical sepsis alert that will show up when you try to open a file of patients who's been identified as being at risk of sepsis. It'll give you information as to why it is selected. Also, sepsis and septic shock alerts are separate. So if you suppress a sepsis alert and the patient evolves into a septic shock, you will get a new alert for the septic shock. If you launch the advisor and sign the orders, that will suppress sepsis alerts for that patient for 72 hours. If you just open the chart and you don't do anything else, there will be no suppression. If you try to open the chart again, it'll fire a sepsis alert again. You can, if you're opening the chart, suppress alerts for a multitude of reasons. The first three here will suppress it for 24 hours. If you choose a chronic condition, it'll suppress it for 48 hours. There is also a suppression for 1 hour only for you if your role does not relate to sepsis. Say, for example, you're doing a consultation on a patient and you're not the MRP, or you're opening the chart for another reason not related to treatment, like a chart review. Two things I want to highlight about the difference in alerts between doctors and nurses. There is no cross suppression, so doctors won't suppress alerts for nurses and vice versa. So if a nurse opens the chart, that does not suppress the alert to the provider. The other thing is doctors can run the whole Sepsis Advisor and sign the orders, while nurses can run the advisor. They can send you the orders for signature. However, this is not really an advised workflow, as there is a lot of decision making that needs to be done in the advisor, as you will see, and you should be running the advisor yourself. So there is no more adult sepsis order set in the emergency department. You launch the advisor, and that's where you manage sepsis. This is what the Sepsis Advisor looks like. At the top, there are patient identifiers and the 3 stages of the advisor. I want to bring to your attention this here. This patient has triggered advisor for sepsis. However, if you change this, that will give you different recommendations. Say this patient's hypotensive and I want to treat him for septic shock. If you pick septic shock, it will make recommendations related to that, especially, for example, giving you an option to run vasopressors. The next thing you do is you choose your source of infection. You can choose up to 2. Any one of them with a red asterisk has submenus that you have to pick from, and then go to select recommendations. This will take you through a cascading list of recommendations. At the top, you will see any active antibiotics that the patient's on, and then you select your creatinine clearance and dosing. For us, we will use ED dosing, single dose, but you can also do normal dosing, dialysis patients, or adjusted dosing. The first thing it gives you is options for antibiotics, and it gives here, for example, in this case, it's giving 3 options and an addition, and then you keep scrolling down. And you will see that this will repeat itself. You select your fluid boluses, you select your fluid maintenance, your patient care issues like oxygen, catheters, etc. You add any radiology test that you might need to add. And if you keep scrolling down, it takes you through a multitude of lab tests, more lab tests, and then options for vasopressors, and then you hit confirm. This will take you to the list of your orders. You can add sepsis or septic shock to the diagnostic list, and then you go to signing the orders. This takes you to a familiar place. If you remember from our orders video, this is where all orders go to live. And here we will go through all the missing fields that are mandatory, and then we will sign. And we are done. So let us demo the Sepsis Advisor. So let us demo the Sepsis Advisor. You can launch it from anywhere, as we said. What I'm going to do is going to launch it from the patient's chart. I'm going to pick this patient, and this is my ED workflow view. At the top is there's new orders, so I'm going to search for Sepsis Advisor. And there it is. We'll start from the top and we'll work our way down. Sepsis, I'm going to change this to septic shock as the patient's blood pressure is low here. There are no other results in this patient. I'm going to select a possible source. Let me select pneumonia. And from pneumonia, I'm going to say community acquired. I can also add another reason. So let's add skin and soft tissue, and this patient's diabetic. I'm going to launch the recommendations. No current antibiotics. From my end, I don't need any of those. It's just an ED single dose. For this guy, I am going to choose option 1. So I'm just going to give him piperacillin. I'm going down to fluid therapy. We will add 2 and 3 liters later. These are very small doses. So I'm going to get into the habit of just giving him 1 liter of saline and 1 liter lactate, because changing the orders later is way too much of a hassle. And then let's keep him on sodium chloride 125. Let's give him some oxygen therapy and put a catheter in so that we can create something we have to attend to down the road. You can pick up your collection of whatever you need. Investigations, radiology, sepsis assessment, probably in the ED. These were already all done. We can clear them out. I'm going to add another lactate just so I can see where things are trending. Nothing else that I need here. Now, by changing it to septic shock, it added the option for me to use vasopressors. So I'm going to pick norepinephrine. I'm going to confirm, and these are all my orders. I'm going to add septic shock to the diagnosis of the patient, and I'm going to sign my orders. Wants to know what oxygen level I'm targeting, and here we go. Look familiar? This is where all your orders come to live. We know that we have 2 things we need to attend to. If you hover over them, it tells you what they are. However, as you remember from my orders video, all you need to know is this button here. So let's missing this, indwelling. What else is missing? So he wants a starting dose. Let me start at 5, for example. Now it does have a range here already set in, so the nurse can titrate to effect. I'm going to hit sign, and we are done. I hope you found this helpful. If you have any questions, you know how to reach me. Otherwise, thank you very much for your time.